the testing and diagnosing that their medical care physician can. But if there's some elevated levels as far as their lipids or the cholesterol, or, you know, we think that there's some recommendations that we can give to them, we definitely will refer them back to their physician so that their physician can address those issues. In the program, we've had many people come, many successes. We've had people to lose weight. We've had people to come off their blood pressure medication, cholesterol medication. We've had them, but they have been disciplined, and they have worked the program, which means they were very serious about working the program. They didn't just join and stay in it for a week or two and then get out the program, but they were consistent in making the changes. And that's what we're looking for, individual, because if we're going to invest in people, then we need them to invest in their own health.
And so the obesity rate is as high as 60-odd% for African Americans and 50-odd% for Caucasians in Nashville, Tennessee. And
it's in Forbes magazine, and actually they also stated in the survey that 32 hours out of the week we watch TV. And then 22% of individuals have reported that they do not exercise. Now this is something I've learned about doing surveys, and that is we underreport. When it's self-reported, we underreport. So if that means if you ask me how much I weigh, I'm going to tell you what I really want to weigh, and not really what I weigh.
Okay, and so even with the underreports, it looks
still
bad.
It's still high, and so that tells us that there are still some changes that we can make, and we're here to help you. And I will tell you, you know, when you're talking about making changes, your family, definitely you want that support system with your family, your church members, your pastor. You know, you want people to be able to assist you and help you make those changes, along with you being disciplined. But sometimes it takes people outside of your home, and that means some people who are going to be your cheerleader, but also your accountability partner, and that's what we're trying to do. We're going to be that. As a lifestyle coach, you're going to get your own coach. You'll be able to work with us one-on-one. You're going to do the mentoring sessions with us one-on-one. We'll give you educational kits. You'll get homework. You'll also get a partnership. We partner with Metro Park and Recreation. 6 months free to any of the gyms in Davidson County. You'll be able to receive that as long as your physician gives you clearance to participate. We have additional classes, community groups, ballroom dancing, grocery store tours, nutritional groups. You name it, we have it, and it's all for free, but we want you to be consistent, and we want you to also be serious about making that change.
Well, this seems like an excellent effort. Is this program national? I mean, when we find it in Nashville, do we find it all across the nation in
well, we
cities?
hope for it to be national, but at current, it is just in Nashville. We said that Nashville is very blessed to be able to receive a program like this, but we have to make sure that we have a lot of people to participate so that we can prove to them that even though our rates are high, we have people that want to change, and they can duplicate these efforts in other cities.
Very good. And of course, the way we do it in Nashville might be instrumental in terms of dealing with this as a national problem here, because we've got a very good model. And I think the way you've explained it, CGreene, that the city of Nashville is doing an excellent job, and Metro General Hospital is doing an excellent job in terms of trying to meet the real need, because this is indeed a real need, because I think that there's so many things that are associated with this in terms of cost. I mean, you know, life certainly is precious and et cetera, but you know, people who become involved in some of these diseases and et cetera, that's a very, very expensive proposition for everybody, insurance companies, the nation, and et cetera. And of course, during the last half minute that we have here, I just want to thank you.
Thank you.
And the excuse me, and other members from Nashville Metro General Hospital that we've had an opportunity to talk to, and to simply applaud the institution for some of the things that they are doing in terms of trying to meet a real national crisis that we have dealing with health in this country. And of course, let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.